Okay, good morning, medical students. Thank you so much for having me. So today we'll be talking about climate change, but specifically through the health lens. So when we often talk about sea level rise, we talk about melting ice, loss of habitat for animals, but from my perspective, climate change is all about health. Okay, so in 2018, I don't know if you all remember this, but Guy Hagi scared the living daylights out of me. Do you remember Hurricane Lane? So Lane was a Category 5 hurricane that was headed toward us. So why am I linking a hurricane with climate change and health? In my brain at the time, I had a feeling there was a link between hurricanes and climate change, but I wasn't exactly sure how. And when I link this to health, as a physician, I immediately thought about all the injuries, deaths, trauma from hurricanes that affect our patients, and that's health. And that is the thing that I realized at the end of the day, people really care about. We care about our family, our children, our neighbors. So starting to think about climate change through the health perspective can be a very powerful way to enact change. And here's the one thing I learned about climate change and health. Climate change is what we call a threat multiplier. So climate change makes existing problems worse, including social problems, economic problems, and health issues. And the way a hurricane impacts a developing country is very different than a country with more resources. So this is a picture of Mozambique in Africa. And this is Cyclone Idai in 2019, and this was a Category 3 hurricane. So that left thousands of people dead. It sparked a humanitarian crisis affecting millions of people. And the point is this: those people that contribute the least to climate change are the people that suffer the most. This is a pinwheel graphic, and this is our framework of how we think about climate change and health. So climate drivers of health are rising temperature, increasing greenhouse gases, rising seas, and extreme weather. Those in turn have an effect on exposures, so air pollution, water quality, and extreme heat, for example. And then those exposures have subsequent health outcomes. So extreme heat causes heat-related illness, air pollution causes asthma, cardiovascular disease, things like that. So ringing all of these impacts in pink are the mental health impacts of climate change, and we'll see that and we'll talk about that. But eco-grief, eco-anxiety, PTSD, and depression. So we'll start with extreme heat. Rising temperatures from greenhouse gases cause extreme heat, which affects health. When I started giving versions of this talk back in 2020, I really felt the need to show how extreme heat was relevant. Now it's all over the news. In the summer, thousands of people died at the Hajj last year, according to Human Rights Watch. All we need to do is open the paper in the morning because heat is the headline. And I will spend a lot of time on heat because it's especially relevant for different populations. And it affects us here in Hawaii. This is Waialae Avenue on a hot day. I'm sure you can feel this and feel what that feels like. So there are a lot of graphics and data showing that it is actually getting hotter in Hawaii. Average temperatures have increased across the state. And these increases are statistically significant. So from 1950 to 2000, average temperatures have gone up about 2.5 degrees Fahrenheit on average, and we are climbing. And we feel the heat, especially in the urban core. You all have felt this. And this is something called the urban heat island effect. So the urban heat island effect is not climate change, but it's a man-made problem that exacerbates increases in temperature due to all of that concrete and asphalt absorbing and releasing heat day in and day night. And this is intuitive. You feel this when you go into hot places that don't have shade. In rural areas, those green trees, they absorb water from the soil and they release that water from the leaves, and that's a cooling process. So, in the city, that absorption of heat continues to release all day and all night as well. And that's why it's hotter in the urban core. And this gets worse during a heat wave. So when you look at community heat maps, so we have heat maps of Oahu. I don't think we yet have maps of the other island, but the hotter it is, the more red color. So you can see that the urban heat islands are downtown here. This is the airport, Kapolei, and on the west side as well. Waianae Coast is actually quite hot. This is less of an urban heat island effect and more of the geography of the islands, how they trap heat. And when you overlay that with a map of where our poorer patients, our lower income patients, our most vulnerable patients live, when you look at the census of people living below poverty, you actually see that it kind of matches. You have larger areas of people with lower income in the urban core and on the heat islands. And that's really important for physicians to recognize because, again, our most vulnerable patients are living in the hottest parts of the island. Who else is vulnerable? Pregnant women and their babies are vulnerable. So in pregnancy, if you're exposed to adverse heat or heat illness, that can cause low birth weight, preterm birth. Newborns and children, they can't adequately yet physiologically adapt to heat like adults. Older adults, people with chronic illness, all those people can have vulnerability in a heat wave. Of course, the medications that we prescribe to our patients routinely can also cause vulnerability in a heat wave. So how does this happen? If you take a diuretic or blood pressure meds, that can lead to dehydration. And that's on top of the dehydration that you might be experiencing from heat. And dehydration can impact the heart and the kidneys. Other medicines can impact the body's ability to sweat and cool down, and even some psychiatric medicines as well. What's interesting is that we even see that heat itself has been associated with suicides, depression, substance abuse, aggression, domestic violence, irritability, and sleep problems. We've all experienced that. And so people with pre-existing mental health conditions, people who have dementia, those who are on psychiatric meds, all of those symptoms can get worse during a heat wave. The body does the right thing during heat, and the body responds in a couple of ways. So when you sweat, you evaporate and you cool down through the skin. There's also conduction. So if you think about when you're wearing shorts and you sit on a metal chair, that chair takes the heat from the body. And then there's vasodilation and heat exchange, and that just means that the body brings blood to the surface, opens up all those blood vessels, and heat goes out through the skin. So heat illness is a spectrum, and there's mild heat illness all the way to heat stroke. There's a lot of terms that you hear thrown around, but basically think of it as mild, moderate, and severe. So at the milder stage, you have heat cramps, heat rash, heat edema, that's just swelling. So when you lose water and salt, you start to have some cramping, you can get itchies, you start to feel all those things that we felt on a hot day. So that gets better when you put on cooler clothing, take a cold shower, elevate the legs. As your body starts to heat up more, we start to see, as the body gets hotter and hotter, that blood flow doesn't go where it's supposed to go. Instead of going to the kidneys and the heart and even the brain as it gets really hot, the blood is really just trying to release all of that heat towards the skin, and that's where it can be fatal. So what do? We have our patient lie down, we do cold compresses, we elevate the feet, we have our patients drink cold water. We try to get people to AC. If you have a fan, you can use a fan, but it's interesting, above a certain temperature, fans in a dry heat are not very effective, but in a humid heat like we have, fans can actually blow sweat off the skin and help to evaporate and help to cool the body. So those are all things. If a patient gets into big trouble, like a young person on the athletic field, you'll start to see, hopefully, that people, younger athletes are now being cooled down in ice baths. And I don't know if you've seen this, if you've been on the sidelines of a marathon and things like that. So now the thinking is we cool first and we transport second. So you get that patient into an ice bucket, ice bath, cool the core body temperature down, and then you bring them to the hospital. So when we talk about solutions for climate change, one of the things we talk about is mitigation, and two of the things, mitigation and adaptation. So mitigation is doing things to remove greenhouse gases. Adaptation is something that you do to change your behavior to a climate change effect that's already there. One of the wonderful things about trees is trees mitigate greenhouse gases. So they draw carbon dioxide from the atmosphere and they help reduce our CO2. But it also gives us a very nice co-benefit to health. So trees provide shade, they cool us down, and there's even evidence that there are psychological benefits of being in nature. So even if climate change wasn't occurring, trees and planting shade has a wonderful effect on our health in its own right. So let's move on to severe weather and floods. Severe weather and floods. However, when I first started giving this talk, I focused mainly on storms and floods, but it actually also includes wildfire. So when I started giving this talk back in 2020, the deadly Maui wildfires hadn't happened yet, the Los Angeles wildfires, all of the stuff we hear about, but that has obviously changed. When you think about an individual event like a hurricane, one particular hurricane can never 100% be attributed to climate change. And the better question is, how are extreme events occurring more frequently or more severely, and how much more likely was that hurricane to occur in the presence or absence of climate change? So this brings me back to my Guy Huggy moment. So we know that when you have warmer water temperature, there's more moisture in the air, and that brings more fuel for storms. And that increases the potential for these tropical cyclones to have heavier rain and higher storm surge. So in Hawaii, the current thinking is that the storm intensity will increase. So instead of having a Category 2, we might be looking at a Category 4 hurricane or even a 5, but that the storm frequency will either decrease or remain unchanged. So at the beginning of the hurricane season, you hear that it's a normal, average, or below average frequency. So they expect 3 to 5, or whatever the number is. But the thing that has changed is now, because it's warmer, those 3, 5, 4 hurricanes, they might be a higher intensity, which means more damage to property, structures, and of course, human health. So when we think about climate change and the Maui wildfires, climate change created, influenced a warmer, drier condition that dried out all of that vegetation, and it actually contributed to very abnormal dry conditions in Lahaina that actually helped the fires to spread. So essentially, a warming climate creates ideal conditions for wildfires to ignite and spread rapidly. So it may have actually amplified all of the conditions that led to the deadly inferno. There are other things that we have to think about. Again, you can't 100% blame it. So there was the sugarcane industry that died out, and then all those invasive grasses went in as well. But all of those factors came together to make that fire particularly deadly. This was rain in 2021 from a Kona low. Again, a Kona low is a naturally occurring phenomenon, as is a tropical storm, but the climate signature was that that storm had much more precipitation, higher winds that actually worsened flash flooding. So when we think about climate change and health and these storms, you can start to think about the direct causes of getting injured from a storm. So a tree falls on the house, people get injured or they die because they're flooded or they don't know how to swim. And so this is in Hawaii, Haiti, Hurricane Ike in 2008. So if you look at this picture, you can just think and worry about drowning, injuries, people getting hit by debris, all the ways that a storm can hurt people. This is a picture of Hurricane Maria in 2017 in Puerto Rico. And this helps me think about the indirect effects of a storm, right? So this is after the storm. This person survived, but he's exposed to all of the bacteria and pathogens when he's trying to clean up his driveway. I don't know what he's trying to do because there's so much water, but so those are the indirect effects from a storm. And what if you're cleaning up all of this debris or you're sweeping out water and you have a heart attack? How are you going to get to the emergency room in these conditions? Does your emergency room still exist? What if you have to go to dialysis every 3 days, every 2 days? How are you going to get to those facilities? What if the electricity is out? All of those things. Where are you going to store your insulin if you don't have power? So in some parts of Puerto Rico, they went without power for a year. So if you think about that, think about the availability of fresh foods, if you're eating processed foods, all of those things impact health. And then we worry about mental health. So we saw this with Hurricane Katrina. So these citizens were just being packed into that Superdome. And several studies, scientific studies, have shown increases in anxiety, post-traumatic stress disorder among storm survivors compared to people who did not experience the storm. And we saw this on Maui too. We saw a lot of these issues. Back to fires just for a second. So we can see trauma and injury and deaths from fires just like we saw with flooding, but wildfire also poses another health effect. So when things burn, all of that smoke contains soot, carbon dioxide, toxic gases, all of that plastic and metal and fabricated non-organic stuff that you are burning goes into the air. So all of those compounds can be breathed in, and they can also be released into water. And so people come into contact with all those toxic materials through the air, through the drinking water, through contact in their skin. And so this is another indirect cause of how people get harmed during these severe weather events. And one more thing about wildfires. So the particulate matter, PM is particulate matter, it is so small that it can actually cross the blood-brain barrier. So what is the blood-brain barrier? So your brain has a protective layer or filter around it. It's very, very smart because you want to prevent toxic substance from getting into the body's most precious organ. But these PM 2.5s from wildfire, they can cross into the brain, they can get into the lungs, the heart, and they can cause inflammation all over the body. So again, this is affecting our really vulnerable populations. So pregnant women, the developing fetus, children, our kupuna, people with chronic lung diseases and chronic heart diseases. We really have to be careful about that. This is from Hawaii Wildfire Management Organization, and it shows how many areas of Oahu are kind of at risk and worrisome affected by a wildfire. They do have maps for other islands, but I wanted to show you Oahu again because when you look and you overlay that among our most vulnerable patients, you can see that it's almost a similar map. So we really have to pay attention to the people who have the least amount of resources because those maps overlay. So related to extreme weather in our neighborhood is the sea level rise and environmental degradation. We'll talk about what this means in a minute, but when we think about the health effects of sea level rise and the environment not being good, being degraded, we start to think about climate migration and mental health issues. And it may feel like migration issues are on the mainland, but actually they are here too. So in our neighborhood, in our Pacific Island neighborhood, the Pacific Islands contribute less than 1/10 of the world's greenhouse gases. However, we know that these atolls are at sea level, and they're a region that has already and will suffer some of the most devastating consequences. So this is in the Marshall Islands, and you can see that graveyard is being eroded by sea level rise. And in 2019, the country declared a national climate crisis. They were trying to decide whether they should relocate the whole nation to certain islands or just rebuild at higher elevation. And so climate change is one of the reasons why people are moving. There are other reasons as well, but again, climate change is a threat multiplier. So we see this already. This was a Micronesian family in a shelter in Kalihi. They were profiled in a homelessness and climate change article in the Huffington Post a few years ago. So people are here already. So there's about 20,000 Micronesian migrants here in the state of Hawaii. And we have to be equipped to care for them. They're moving for a variety of reasons. Some of that is climate change. So do we have enough physicians to take care of them? Do we have enough resources? Do we have enough mental health providers? All of the things that affect an additional population of people. And there's evidence too, people have studied this here in the University of Hawaii, that these patients actually have worse health outcomes compared to other populations living in our state. So all of these things we have to think about as physicians, specifically from the health aspect to climate change. So related to storms and flooding are the impact of climate change on water quality. So in general, we all know this kind of makes sense. When the temperature goes up, bacteria and bugs and viruses, they can live longer. They can have more time to reproduce, and they have a faster life cycle. So when you think about what happens when the ocean gets warmer and you have more bacteria, that can affect freshwater and marine water quality. And you can even have this through runoff. So as it gets warmer and you've got farm and livestock runoff or water treatment, and it comes into contact with the places where we swim or things like that, you know, all of that bacteria can stick around longer. And when we have sea level rise, we worry about the seas eroding some of our sanitary pipes, our infrastructure, and that can also spill more bad stuff, bacteria, into the water and reproduce faster and stick around longer. So what might we expect with climate change in Hawaii? So there's a study in 2011 that looked at, again, Oahu looked at some streams, and about half of them had pathogens like Salmonella, Campylobacter, Staphylococcus, and Vibrio vulnificus. So if this is the alloy, so if the alloy floods over, you think about all of that bacteria in there and people coming into contact with it. So the stagnant end of the alloy canal contains Vibrio vulnificus, and that's a particular bad bug, and it can cause a really nasty wound contamination and bacterial infection, especially if you have an underlying disease that makes you less able to fight off infection. So we really have to think about this when our streams and our streets start to flood. Think about all the bacteria in there and people coming into contact with that. Another thing, another bucket, a way of thinking about health is the risk of invasive vector-borne diseases. So what is a vector? A vector-borne disease, or a vector, is an animal like a mosquito or a tick or a deer that can transmit disease. In Hawaii, the vector that we live with is the mosquito. On the mainland, it's mostly ticks. I'm sure you've heard of Lyme disease, things like that, Rocky Mountain spotted fever. We do not have those ticks here, but we do have the Aedes albopicus mosquito. And this mosquito has the ability to carry the viruses that cause dengue, yellow fever, chikungunya, and Zika. So again, we see the same story. When it gets hot, when the temperature rises, when there's more rain, that favors this mosquito life cycle. So this little female, because the females are the one that bite, she can live longer, she can have more babies, she can reproduce faster. And as it gets hotter, mosquitoes can move into places that they weren't previously able to live. So now we have people who lived in cooler areas, but now it's getting warmer and we have more mosquitoes. And these particular mosquitoes love living in containers of standing water, so buckets, tires, things like that, and that's where they reproduce. In Hawaii, we do not normally have these viruses circulating. So what that means is they're not endemic. They're not really present in our everyday. But what we are more likely to see is travel cases or imported cases. So that happened on the Big Island in 2016. They had 216 cases of dengue. So how did this happen? someone from the Big Island traveled to somewhere in our Pacific Island neighborhood where dengue is endemic. So maybe they went to like Fiji or the Solomon Islands. That person got bit by a mosquito on vacation. They got dengue. Maybe they knew, maybe they didn't know, maybe the symptoms didn't appear till they got home. They traveled home to the Big Island, and their local neighborhood mosquito bit that person. The mosquito got infected and then started biting other people. Local mosquitoes bit all those other people, and then all of a sudden you have 216 cases of dengue. So this was contained because we have the ability and the resources. So they did a nice public health outreach. They told people to get rid of their standing water. They told people what the symptoms are to come in and get checked out. The thing about dengue is there's no cure. So all you have to do, the only thing that we can do is support the patient. So the symptoms are fever, eye pain, muscle pain, headaches, nausea, vomiting, bone pain. The pain is so bad from this infection that people call this bone break fever. It's quite bad. So the only thing we can do is give fluids, give medicines for the pain, and hope that the body clears it naturally. And then this is the typical rash that we see in dengue. So as physicians, we have to be alert for this. As it gets hotter and people travel, we have so much travel now, more than ever, but we have to be alert for this as things get warmer and these mosquitoes are more able to infect people and stick around. This is a very big topic about food system impacts. So climate change will impact our water and our food supply, and that could lead to a number of different problems with health. It's a pretty big topic, but we know that drought can impact how much food we grow and what types of food we grow, and of course that will impact health. We know that climate change can impact the quality and the amount of fish that we catch. There's evidence that tuna in the Pacific is migrating to cooler waters. So this is one thing we have to be aware of. And as people shift from a traditional diet of native vegetables, native fruits, and plants, and they move to a processed diet of imported food, spam, canned food, things that are salty and bad for you, that can impact health very obviously. So, and as physicians, we know that sometimes as little as 1 or 2 salty meals can put a person into the hospital from heart failure, kidney issues and things like that. So that the fish is really a relevant issue because as people move to eating these, modern diets, it's not good for health. And climate change can also impact food by contamination. So these insects that love warmer weather, or viruses or fungi or bacteria, they can impact the quantity of our crops, and that can cause prices to go up, and that can impact people's choices about what they're going to choose, if they're going to choose a healthier, more expensive meal or something that's canned and processed. So all of these things impact health. And we even see political instability from food systems. So food prices were one of the contributing factors in the Arab Spring uprising in 2011. So really, we have to be thoughtful about what we plant, what we do with the land, how we have a mix of livestock and crops, and how much and what we take out of the ocean. So just to talk about mitigation for a second. So mitigation is reducing greenhouse gases, for example. So emissions from livestock account for about 25% of greenhouse gases, and roughly 2/3 of those emissions come from cattle. So they burp out and they expel from their bottoms methane, and also you can count that if you clear forest or crops and things like that, that takes away the ability of that forest to remove CO2. So if you graze livestock as well, that contributes. So it's interesting because methane, carbon dioxide in the atmosphere takes hundreds of years to go away, to dissipate. Methane is very, very potent. It's very strong greenhouse gas, but it only takes 12 to 20 to 25 years to go away. So it seems like a long time, but compared to carbon dioxide, it's short. So it's very interesting. If we were to eat less red meat, that would have a significant impact on greenhouse gases. But interestingly, from a health perspective, we know that eating less red processed meat is better for our diets. So we know that eating that kind of processed red meat, lots of it, there are large studies, millions of people, that's linked to coronary heart disease and things like that. So you can do something good for the environment, and you can also do something good for your health. So that's another example of a co-benefit. So reducing the amount of meat can help the atmosphere, but it can also help your heart. So we have seen in general a wide range of health effects, both direct and indirect, on your physical health, on mental health. They can harm us by worsening chronic diseases. So how are we not all depressed or anxious about this? My personal way of combating this is a couple of things. So first of all, we know that climate change is solvable. We know what to do. And it's not only this new technology that will get us out of this mess. We have ancient indigenous practices that managed the lands, that took care of the water and the people for centuries. So there's no place, I was just telling Kamal that there's no place I would rather be than Hawaii, because Hawaii is doing a lot of innovative things both to combat climate change, but also things that are good for our health. We have lots of farms here. There's a push for local, natural, organic food to be more food self-sufficient, because as you all know, we don't have a lot of food stocks on the island. So all of these things, thinking about how we're going to help our climate and help our health at the same time, there are really wonderful things happening here. Here's some information about some ways to get involved. This is a group that I started a couple of years ago, and you are all welcome to join, but it's called the Climate Change and Health Working Group. This is the URL address. I can share again with you later. And we invite you all to join. So we're a group of physicians, nurses, nonprofits, basically anyone who's interested in working on climate change, specifically through the health lens. So I'll tell you a little bit about the work we're doing around the state. So we do these listening sessions. This is one of our physicians, our Native Hawaiian physicians, and we go into the community like Waianae or Kapolei, and we give a very, very brief overview of like what you heard today, maybe 5-10 minutes, and then we listen to the community, and we ask, what is your most pressing concern? So we hear a lot about heat out in Waianae, and we are able to then bring programs back into the community. So our group got a grant from the DOH and a group called the Kupuna Collective, which maybe some of you know about, which is a group of Kupuna who are really interested in learning and doing things, and we're gonna train some nurses to train these Kupuna champions and go out into the community and talk to people about the meds that they might be on that affect heat, how they can cool down, things like that. So yeah, it's a really wonderful way of hearing from the community. The other thing we do is we hear about what's impacting the community, and we go and we bring that to the legislation, and we try to amplify community voices. So this is me testifying on a bill that we helped to write. Again, we hear about heat, and we heard concerns about heat-related illness in athletes. So you think about all those football players in helmets and padding and all of that stuff playing on a field without shade. And on the mainland, many, many high school and middle school kids have died after football practice or a game. And this is very scary. We have not had a death yet here, hopefully, in Hawaii, but we're trying to enact and put protections into place and have people monitor heat so that when it gets too hot, you follow a guideline and you have water breaks, you have shade, and in some cases, if it gets really hot, you just don't hold practice because it's not worth it. So those are some of the things that we're doing to help really change, move the needle on climate change by using the health perspective. So I will just end with the fact that climate change can be framed in many ways, but framing climate change as a health crisis makes so much sense to me, and I hope if you agree, you will join us, and we would love to welcome you to our group. So thank you.
Thank you, Liz. Thank you for an enlightening and a little scary talk. Do we have any questions? I have, oh, go ahead.
What do you think about the ginkgo project? And also, I've read about feeding cows seaweed, adding that to the diet. It really changes their production of gases.
Yes, very true. So when you say, you mean the Genki balls in the alawai?
Yeah.
Yes. So I've heard I've heard mixed stuff. So Genki ball is a mix of it's like a ball full of organic material, and kids have been making these and throwing them in the alawai. And the thought is that particular composition can help get rid of some of that bad bacteria. So I've heard that it's done some good stuff, and they hope to have it clean in a couple of years. I've also heard that maybe they're not as great as we thought, but I'm not sure. So, but yes, that it is something that people are doing and hopeful. And then there's some interesting, it's a company in Hawaii, I think, who have farmed kelp and seaweed. And it turns out if you give seaweed for cows to eat, they actually burp and emit less methane, which is better for the environment. So that company, I think, is trying to get off the ground.
There's a question here. When it comes to climate change and potential natural disasters, where is the safest place in the USA to live?
Oh, boy. Oh, boy, I don't know. On the mainland, you have tornadoes. You also have hurricanes. You have drought. You have wildfires, right? Everywhere has its own particular threats. So I don't know. Does anyone have any good ideas? I have no idea. I'm happy to be here. I think that Hawaii is very unique. We are working really hard. We're really trying to work on climate through many, many different ways. So,
Do humans contribute to the methane release? And if so,
I
should
don't
we eat
think
more
so.
seaweed?
Not as much as cows, but if you want to blame your partner, you can.
I'm confused, surprisingly, when you talk about processed meats.
Yeah.
And then this photo, just because it's been ground and it's fresh in the market, does that make it processed?
No, I just put that in because it was a picture
Oh.
of meat. But
Yeah.
in general, we know that eating a lot of red meat is not great for you. So yes, but the processed ones are the worst.
Like prepackaged meals and that kind of stuff.
Yeah, like meat that has like nitrates and all that. So sometimes you'll see on meat, it'll say no nitrates, no processing, things like that.
Great,
So,
thanks.
So growing up in Hawaii, we always had a lot more vegetation in our yards.
yeah,
Since we had the monster homes, and if you notice,
yeah.
everything is cemented. There's
Yeah.
no. So I was hoping there would be a move in our state to encourage people to plant in the yard trees and flowers, and just because I notice there's more and more yards that either have rock or cement
Yeah, in terms of shade.
in terms of
Yeah,
shade.
for sure. It's a really interesting dynamic thinking about some of those homes that have the dried grasses too, and the things that are flammable. And if you don't know about FireWise, you can look it up in your community to see if you're a FireWise community. So FireWise is a national organization. I'm FireWise chair for my neighborhood. And what they try to do is they bring in wildfire experts, and they look around at your neighborhood and they say, this empty lot here is a fire risk because it's full of Guinea grass and California grass. And if that ignites, so a car backfires or a weed whacker has a spark, if that ignites, then all those sparks can go up in flames, and then those embers can be carried by the wind and ignite homes. So they help to go around house by house and say, these native plants are more fire resistant. So we know that native plants here are fire resistant. And they talk about the way that you want to plant away from your home and create like a little buffer or clear out dead leaves. It's not saying that you have to have no trees or no beautiful landscaping. It's just saying all that dead stuff that falls on the ground, you want to sweep up because that's the stuff that can ignite. And so it's a really great organization. I would encourage you to check it out. It's called Firewise, and see if your neighborhood has one.
I wanted to ask you what is known about the impact on health of the volcano erupting so often.
Yes. I feel like the pulmonologists among us know more about this, but we do know that that VOG can contribute to asthma, COPD exacerbations, things like that, because it has a lot of those toxic particulate matter in it. So, yes. And then we know that when you have air pollution and then you have heat, so that when it's on a hot day, that can trap the heat and the pollution low to the ground and keep more of it around. So it's kind of like the smog principle in LA too, how those mountains and the heat trap all of that bad pollution.
Any more questions? I don't have any online either. Thank you so much, Liz.
Yeah, thank you.